Good evening, ladies and gentlemen. Welcome to our next episode of Let's Talk About Sex on JTV Channel 55 and 013.7 FM. Today, we're speaking about the Caribbean HIV Regional Testing Day that took place, a couple Fridays ago in different respectable places, Scotiabank, in the ministry, and other places, and even in the Caribbean itself. And we have some very special guests today on the panel. Doc, how are you?
I'm fine. And I'm very pleased that we're having the show tonight focused on the Caribbean HIV Regional Testing Day. It's a very significant day for the entire region, but especially for the BVI. And so before we go any further, I'd like to introduce the panel. Mrs. Nolene Clark, coordinator, the National AIDS Program. Ron Grant, member of the HIV Foundation. Shanika, help me with it. Okay, who's with Scotiabank, and Stacy Lloyd, Scotiabank, and would you introduce yourself?
And Stella O'Neill.
With Scotiabank. Okay, and I apologize for not remembering all the names, but it's very important that you're all here tonight with us because you all participated in organizing the testing day. And what I'd like to say to all of you is that you should be applauded for implementing this activity because it is a significant opportunity in the BVI for us to offer HIV testing to the community because that's the only way we're going to be able to determine how we can plan for this disease that's been affecting us. So if we could just take a couple of minutes to give the history or the background to the HIV testing day. I don't know, maybe Scotiabank would be able to do that because Scotiabank took the lead on this throughout the region.
Okay. Actually, we started here in the BVI in 2009, but the Regional Testing Day program itself started in 2008, the pilot being in Barbados.
Right.
That was actually where the idea came from, in Barbados. 2009, BVI joined in. We only had one testing center, which was our Wickham's Key branch. And then in 2010, we joined, Virgin Gorda joined in. So we had two branches. And this year, we had Virgin Gorda and Rotong branch, and also we did testing at Anegada Clinic. So that's the basic background as to testing day in the BVI. And regional testing day is actually, the date is June 27th, but we capitalize on the traffic in the branches, so we usually keep it on the Friday because we realize that a lot of people come to do their banking on Fridays, so we capitalize on that. That's why we had it on Friday the 24th this year.
Right. I would just like to ask if you know the background to how Scotiabank got involved in this activity.
Actually, it was Dr. Alison Leacock.
Right.
She brought it forward to Kevin Tisnick, who was the managing director of Barbados and Caribbean East at that time in 2008, because Scotiabank always have an active relationship in the community, so she thought that we would be a good partner. So that's actually how it began.
Right. And what's the relationship between the National AIDS Program and Scotiabank? How do you partner on this activity? Ms. Clark, can you possibly give us some information on that?
Sure. Annually, Caribbean Broadcast Media Partnership sends the invitation through PANCAP to the Ministry of Health and also to
PANCAP.
Scotiabank,
Yeah.
the Pan-Caribbean Partnership Against HIV/AIDS.
Right.
And as soon as Shanika gets the email or I get the email, we'd call each other and then we'd start the ball rolling.
Right, right. So in other words, it's a collaborative or a partnership arrangement.
Yes, it is.
And when the program first started, you said it started in Barbados?
Yes.
Okay. And it started here in 2009. So this is the third year that we've had the National Testing Day here. What goes into preparing for an activity such as this?
it has a lot of back-end work. Scotiabank is actually responsible for the logistics. We take care of actually the locations, getting the chairs, everything set up. And the Ministry of Health and National AIDS Program takes care of getting the medical personnel and counselors and also the testing kits. And also the other information to be disseminated to the general public. They take care of that part. So basically, we take care of logistics and they take care of everything else. And it's a joint effort for the planning.
Were you aware of the National Testing Day, Ron?
Yes, I was aware of it.
Yeah. How did you become aware of it?
I became aware personally by Ms. Clark and also various advertisements. And I'm also pleased to say that made an effort along with a few of my friends to get tested, so our statistics were implemented and a part of the results for the National Testing Day.
Okay. So you got together with a group of people you know,
Right,
and
encouraged
encouraged
them to get tested.
Right,
and
right.
so we were pleased to be a part of the BVI statistics.
Right. Were you able, Craig, to participate?
Well, on my end, it was crowded when I reached the bank. So I basically just, did my transaction and leave. But what I want to ask, though, for instance, preparing for it, what other things you guys had done, whereas in, for instance, to make persons like me, myself, to be more relaxed and want to come in such a setting, being that because once you reach in the bank or wherever you're doing the testing, somebody will pull you and push you and say, listen, go get tested. Have you been tested, or the case may be? What preparation has been done to basically make this message and make it so, I don't want to say relaxing, but at the same time, relaxing as, one to want to just walk in and say, I come to get tested.
But what you're saying is that what was done to create a comfortable atmosphere or environment,
Yes.
right?
I know the environment is a comfortable environment, but, to make one, as you said, there was counselors being there, but to make one feel that, why go ahead, this way, good or bad news, just a mere fact of going to sit in a chair. How you guys had went about it,
Okay, I know on our end, Shanika will be able to speak from Scotiabank because I think they did a good job in terms of distributing flares to their customers. For the National AIDS Program, we had the pleasure this year of having the Executive Director of CPMB, Dr. Alison Leacock, come into country the week before, and she participated in a public television interview on Spotlight with Mr. Cromwell Smith. And then we demonstrated an HIV test just to show the public that it's nothing hard. It's very easy, it's very simple, convenient, cost-effective, and information is confidential. We also did public interviews on radio at ZBVI on Umoja, and basically just meet people on the street. And I know you'll be able to say some more about it because I think they did a good job with the email blast and the print media, utilizing that to encourage people to come in and get tested. And I've always encouraged people, whether or not they're able to come to Regional Testing Day, the National AIDS Program and the HIV/AIDS Foundation is there where they can walk in any day of the week and know their HIV status in 20 minutes.
Okay.
Right, and I think the important thing also to include in this discussion is that the testing was free. There was no charge for the testing to be done on the National Testing Day, just as there isn't any fee involved for someone to come forward to be tested for HIV at the National AIDS Program or the HIV Foundation. So this is a service that we offer to the community, and we encourage everyone to be tested. You need to know your status, and I think that's what you were doing when you were having those media blasts, so to speak, in terms of promoting the event. And I think we need to do more of that. Because that encourages people to come forward. I can remember when we first started doing testing out at community sites. I remember the first time we did it, we had one person come forward to be tested. And then a couple of years ago, we partnered with the Rotary Club in the park, the Noel Lloyd Park, and we tested, I believe it was 75 or 76 people that day, right out there in the park. So people were beginning to feel comfortable, coming forward to be tested. And that's important because, as you said, we need to do more testing. We need to go to various sites. And that brings me back to a question. What were the other sites that were available for people to be tested at?
Okay, as Shanika mentioned earlier, 2009 and this year as well, we had the Wickham Ski branch in Roetown, Scotiabank Limited. Then last year we added the Virgin Gorda branch, which we had again this year at the Virgin Gorda Yacht Harbour. And because the Anegada population or community wanted to be a part of it, and we really wanted to reach out to them, we extended ourselves to the Anegada clinic in the settlement Anegada. And so this year we had 3 testing sites. Hopefully next year, God's Spare Life will be able to go into Jost Van Dyke and capitalize on all 4 of the major islands in the BVI, or also extend to East End and West End in Tortola as well.
As you said earlier about preparing for it, how would you compare 2009 preparing for it for 2010, and then 2010 preparing for 2011? The reason I'm asking it is because, like, for instance, if it's a constant message and a constant activity that is going on, preparation becomes more easy and the awareness becomes more, wide and things like that. Because you have a whole year spent and you get prepared for it in May and the event is June. So you have a month to prepare for it, whereas you have to do a lot of blasts and a lot of these other media airwaves you have to utilize. Would there be any more chance in the future where it will be not just only for one day out of the year?
Well, I don't know you want to elaborate, but what we are hopeful for in the future is that we expand to faith-based organizations, that is the churches, and also having it at these major supermarkets on that testing day, and not only keeping it only on one day, but maybe doing the full week of testing. We're looking at that, and I know Nolene is also looking at having activities throughout the year, not just on Regional Testing Day or on AIDS Day, but also having different events during the year.
Right, to add to that, every year, well, since last year, we went into the prostate screening that is done at the BVI Red Cross, targeting specifically men. That was excellent, it was very successful. We plan to do it again this year. Besides prostate screening, we participated in the HLSCC annual health fair. And this year we tested a lot of students on campus. We were given a private room and we were able to do that, and the participation was excellent. And like Shanika said, we plan to partner with Scotiabank and to work together with other NGOs to move out into the community, move out into the churches, faith-based organizations, supermarkets, UP Cineplex, Virgin Gorda Yacht Harbour, public places where people congregate but can still feel comfortable in an area that's private.
I think there's been a constant increase, as I mentioned before, when I was in the National AIDS Program, where we were doing testing. We were partnering with other organizations like Rotary Club, and we also went out and we did testing when we would do presentations in the community at churches or even some of the schools that we would go to. But, I'm sorry, not the schools, different organizations we would go to. The reality is that when you talk about comparing 2009, 2010, 2011, I think we need to recognize that the first time you do anything, you're not quite sure what you're doing, okay? And it improves and it gets better each time you do something. So I'm sure this year was better than 2010, and 2010 was better than 2009. But that leads me to a question in terms of actually the activity. I know from listening to you present about what happened, I'd like to know a little bit more, if you could share with us a little bit more what Scotiabank actually did during this activity. I know you did a lot of preparation, you offered the venue, the two venues for testing, but what other input, what else did you do during the activity?
You mean during the testing day itself?
Yeah, right.
Well, during the testing day itself, for the past 3 years, we have been, I know Stacy have been on board for the past 3 years. We are been coordinating the event. And what we usually do is that we try to go and visit our branches. So we'll go over to the Virgin Gorda branch, ensure that they have adequate flyers up and so on, try to pass out stuff into the community, try to get a community involvement into it, put up flyers at the community clinic and so on. And here on Tortola, we also pass out flyers and so on the day in our branches and so on. On the actual day, we actually are in the branches and we are encouraging persons to go and get tested. It's not like we're not telling them you must and like it's mandatory, not forcing it in their faces, but we just let them know that it's good to know your status, and just invite them to just go upstairs. And what was great is that Nolene had presentations going on during the testing. So some persons came up to actually do their banking, and they started with the presentation, and they just felt moved to go and get tested.
I'm going to get to that in a moment. But in terms of what you did as the staff of Scotiabank, you passed out literature, you directed them to where the testing was going on, and you were encouraging people to get tested. Yes,
but because we cannot go into the actual testing bit of it, because that is totally out of bounds for us. We are basically the logistics and helping plan and organize. Anything to do with the actual testing, with the confidential data and all that is handled by the Ministry of Health Personnel and the National AIDS Program. So we do not get in depth as to say to that fact.
That's what I wanted to highlight.
Yes, we do not get in depth.
This is a totally confidential and private process. The actual testing is totally private and confidential. And so the Scotiabank staff really just provides support in terms of passing out literature and directing people where they should go.
Little gophers. And we passed out condoms during the week, and we have we ensured that it had adequate supply.
How was that received though?
It was well received. I had to be refilling the containers all through the days because we actually had it for the entire week.
Right.
And actually, as soon as I put the container down and I return upstairs, they'll be calling me, Shanika, you need to bring down some more.
We've been trying to promote condom use through those methods throughout the years, and sometimes we've had more success with it than others. Places where you put them out and people say, well, they shouldn't be here, or let me put it in the back room, or let me put it under the counter and have people ask for it. So I'm really pleased to hear you say that people were asking for it, taking them. That's great.
They were very interested in the women condoms. And they wanted to know how it works. And so on that day, we actually had a demonstration, which was a little bit lively. It should be taped. It was very good.
Ladies and gentlemen, we got to take this commercial break. JTV channel 55, 103.7 FM. Let's talk about sex. We'll give you the opportunity to get involved if you feel like you need to ask questions pertaining to, getting tested. If you have any sorts of shadow that you need to get cleared up on the whole level of getting tested, just feel free to, give us a call, send us a text. Don't forget the show is brought to you by the kind courtesy of CCT Global Communications, Delta Petroleum, 103.7 FM, JTV channel 55, and the BVI HIV AIDS Foundation. All right, be right back after these words.
Let's talk about sex.
The iPhone 4 is now available at CCT stores, paired with the BVI's #1 unlimited calling plan, CCT Freedom, and CCT Zero. Enjoy unlimited voice, text, and mobile web with CCT Freedom, the perfect plan to complement your iPhone 4. Share a smile, FaceTime style, or enjoy unlimited possibilities with access to thousands of apps. The iPhone 4, now available at CCT, bringing you the best selection on handsets and unlimited plans in the BVI. CCT, keeping you connected anytime, anywhere.
One of your neighbors is in the news. Recently, Scotiabank was named one of the top 10 most stable banks in the world. Why? Because of our long-standing performance, our prudent banking policies, and our committed staff. So what does this mean to you? At Scotiabank, you can bank with confidence, and you can count on us to provide exceptional products and sound advice to help you get more out of life. Trust Scotiabank for stability you can bank on, right in your neighborhood. Drop by your nearest branch today.
We at the HIV/AIDS Foundation dream of a world in which people living with HIV are treated with respect, dignity, and justice. A world in which people are diagnosed early and are not afraid to access care. A world in which people are educated about HIV and have the power to protect themselves from infection. At the HIV/AIDS Foundation, we're working to make that dream a reality. Come join us. Together, we can make things better. For more information, call us at 442-0212.
Let's talk about sex.
Welcome back to Let's Talk About Sex, JTV channel 55, 103.7 FM. We're here with Scotiabank, the National HIV/AIDS Program. Mr. Ron Grant is awesome in here today. As I say, we're basically speaking about Caribbean HIV Regional Testing Day. One of the things I want to ask, if we could jump back in it, like for instance, this year, how did both Scotiabank and the HIV/AIDS program made it, as to say, on that line for younger persons? Were there any catering for younger persons on a whole? I mean, yes, Scotiabank was saying, it's a Friday and it's busy where majority of the construction workers come in and take up all the condoms and things like that. But, as far as younger persons, what has been done to send a message to them?
I'm glad you asked. Throughout the year, the National AIDS Program go into the schools and present on HIV. And one of the important things that we convey to students is that HIV testing is available, even if you're not sexually active. And for this year Regional Testing Day, we were blessed to have young people walking even in their school uniforms. It was a wonderful thing to see. It was a level of consciousness that I've never seen before. They say, Ms. Clark, I'm here.
To get tested?
I'm here to get tested.
Okay.
Yes.
Just picking up on that, is there an age limit on the testing?
We usually provide HIV testing for young people 16 years old and older, because 16 years old is the legal age of consent, and basically in the medical setting, no medical procedure should be done on someone without a parent present if they're younger than 15 and under.
But what do you do if someone comes in under the age of 16? How do you cope with that? How do you handle that?
I commend them for coming. I commend, and I always ask them if they have someone that they trust, an older person, because an HIV test is very intimate. It's very sensitive.
What do you mean by someone they trust, an older person?
It
In other words, you need an older person's consent.
You do need a parent, an aunt, an uncle, someone who is willing to take responsibility, if that test result comes back positive.
Right. Well, even to test them?
Yes, yes.
Okay.
Yes.
So there's still an age limit?
Yes.
Okay. Because I remember that coming up many, many times. Youngsters under the age of 16 coming forward and asking to be tested. But once you explain to them that they needed a parent or a guardian to sign for them to be tested, they would not come back, or they would become discouraged. So I think that's great that the youth came forward, and I would hope that sometime in the future we can permit testing for anyone who's sexually active.
Shanika, you were going to say something towards the same thing?
No, I was just going to add to a point that Nolene made earlier, which is just to let everyone know, with the advance of social media, what we did is that we sent out the emails to all of our staff, and we told them, look, post it on Facebook, just get the word out there. And I believe that that is the reason why we got so much attention from the youth, because they are into the Facebook and the MySpace and those things.
And they are very much concerned about their health, especially their sexual health. So we need to try to address that. Even if we can't test them, we need to try to be able to give them information so that they can, take care of themselves. I want to just go back to something we were talking about earlier in terms of how this testing day came about. When we were off the air, we were discussing it a little bit. You want to add to it, Shanika?
Actually, what we were saying is that Regional Testing Day really came about. Dr. Alison Leacock, she made the comment that it was being observed internationally in the U.S. On June 27th. And
when you say internationally, you mean around the world?
Around the world, on June 27th, and she just took advantage of that date and implemented that date for the Caribbean.
That's great.
So that is why we do it on, the actual date is June 27th.
Okay, I'd like to go back to the actual testing process. I heard what Scotiabank did in terms of their staff participating and being very supportive. But Ron, when you went there, did you observe the process, the testing process?
Absolutely. First of all, the testing process is extremely simple. You're giving the opportunity, first you're counseled, persons are informed and educated on the process and, what the procedure will be. You're not giving your name, you're simply giving your initials and your date of birth, which helps the process to be extremely confidential. The only person that is in that room with you is the person that is testing you. And as I said before, it's extremely simple, not even a pricky. Sometimes you don't feel it. And you sit or you can leave the room, for that 20 minutes and you come back. But the important thing is before persons get tested, they are counseled so they know and understand exactly what is being done, and they're educated on what the process will be after, if it's positive or negative. And you do get your results to take with you for your own personal use.
Okay. When you say the process, you mean they explain the test to you?
They explain the test, and they also explain, just so persons can understand exactly mentally, some persons might be a bit timid or scared. They might be hesitant. So you're made comfortable in awareness, in whether it's what is HIV, just so you can have a better understanding of what is really taking place and what might take place even after the test has been taken.
Okay. Did you feel that most people that went forward to be tested went through the whole process, or after learning about what was going to happen, they walked away or they decided not to follow through?
I think that might have been the case in some instances. Persons, they just back out at the last minute because of their own personal fears. But for the most part, all persons are educated, and it's the same throughout. Everyone gets the same treatment, educated, and you feel a sense of comfort. As I said earlier, I encourage some of my friends to go and get tested, and they explained to me how comfortable they felt. How it was a good feeling to know that they were able to get tested.
We're going to have a demonstration here
Absolutely.
of the test tonight. Okay, so the viewing audience can actually see it. You wanted to say
I wanted
something?
to add something, just to add to say that when most persons who came in to get tested this year, they actually came in with someone else. We had husband and wives.
Great.
And the young persons, they came in groups. 3, 2 of them, 4 of them, they actually came in groups to get tested. So they brought their support.
Okay.
So they weren't going through it alone.
Okay.
And what really helped was the openness of the discussion that was also being held outside the presentation.
Right.
It had very interesting information that most of them have not heard before, and they were very interested. They were into it, so that they didn't even realize that the 20 minutes was passing to get their results.
Right. The important thing to remember is that no matter how many times we put that information out, we need to remember that people don't retain all the information. So it is important to repeat those presentations. Nolene, can you just give us a little bit of an understanding of the testers? Are they trained? Are they professional people? What's the situation with them?
Okay, majority of testers, counselors and testers are healthcare providers, so they're either nurses, laboratory technicians, people who work in a healthcare setting, but they are also trained counselors. They are certified trained counselors. So they have either had previous training and been certified, and what we do before Regional Testing Day is to have a refresher. So we have a trainer locally, Mrs. Maureen Smith, who works at Beaver Health Services Authority. She would assist the National AIDS Program in refreshing the counselors and testers just to keep them up to date with their skills.
And who does the actual analysis of the sample that's taken? Are they trained people as well?
Okay, what we do is divide the roles. So some persons will only be assigned to be counselors and others testers. And the testers will be trained to analyze the result and to document it on the log, and then the log will be sent back to the counselor for them to give to the person.
Okay.
Mr. Lloyd, I know Mr. Lloyd is in the Human Resources Department, and you know, being in the bank with so many ladies, such as guys, how was it? Was it the actual workers that they went forward to the testing? Were they timid? How did you find the reaction with the workers?
It was pretty. Well, first of all, let me just point out that this is our third year, so it comes easier and easier every time. I think the program has gained stability. It's reliable and it's valid. So persons have a keen interest in doing so, and they're very comfortable. We stress the confidential part of it, and it's something that we've been doing for 3 years. So it's, as far as promotion within our staff, it's not that hard. We find that our staff want to do it. It's part of their own health initiative that they actually do each year. So actually getting them to go and test is easy. What I would like to applaud our staff on is that they spread the news around to the community, to their family members. Great. So that makes the marketing part even much more easier. So it's just not, Shanika, myself, and Ansela. It's the entire Scotiabank group that actually does the promotion and the awareness and actually the marketing aspect and so forth. So like I said, the program is gaining momentum. I could see us doing this for the next 15, 20 years, possibly more. I know it's going to grow even bigger. This year, the U.S. Virgin Islands Scotiabank actually took part. Huge success. And so, again, the program is gaining momentum, and in itself is just a success.
And I know you take part in the actual Human Resources Christmas caroling, right? How would you like to see where in the next 2 or 3, 4, 5 years, even as it's the next 20 years, the other human resources departments in the other private sectors being on board with this thing? What would you like to see?
Definitely. I would encourage Norleen to actually target like different HR groups, specifically the Virgin Islands Human Resources Association, to partner with them so that they could create more awareness testing with different programs and so forth. So the same marketing techniques, everything. It's just a matter of communication. Education is the main thing, letting everybody know about it. And, it's just a matter of just collaboration. Norleen and other HR persons, word of mouth. I talk to my colleagues, they talk to their colleagues, and definitely something that could definitely be on stream.
Excellent, yeah.
And my last question to you, Mr. Lloyd. What's your views on testing being done to kids under the age of 16?
Me personally, yes. I applaud it. I think that it is a very good initiative, but I do believe that the parents should be involved. I don't think that is something that should be done solely by the underage person. I do think the parents should be involved, that they just have an awareness of what's going on with their child. And so I would support it, but definitely with the parents being involved.
Okay. I can remember a few years ago, we were doing, on World AIDS Day, we were doing some testing at the administration complex, and actually had 2 parents who brought in their children because they realized their children were sexually active, and the children and the parents had agreed that they would come in and be tested, and the parents signed a consent form for them to be tested. So I applauded those parents, and I would encourage any parent that is out there listening or viewing the show tonight, if you know that your child's been sexually active, please think about having that child tested. Discuss it with the child and try to encourage the child to be tested because they're at risk.
But to add to that, I would also like to encourage parents who dialogue with their children, and their children are at a certain age, probably 15, 16, and they're going into a phase of life where they may become sexually active. I always encourage young people, before they begin to become sexually involved, to have a test. So when you start having sex, you know what you're going into with.
Right.
You know exactly where you stand.
Right.
Yes.
We're going to need to take a break, but before we take a break, Ansela, you've been sitting there observing, listening, and I'm wondering if you have anything you want to contribute before we take our break. Anything that you observed or anything that you wanted to share about your observation of the testing day?
Well, it's my first time, and so far there was a lot of people who went to get tested, and I think it was a good way for them to get tested.
You felt comfortable participating, being supportive to the whole activity?
Yes, I did.
Good, good. Okay, we're going to need to take a break. Before we take a break, I just want to remind the viewing and listening audience that the sponsors are CCT Global Communications, Delta Petroleum, JTV, Z-Rod FM, and the HIV/AIDS Foundation.
Ladies and gentlemen, we got to take a small commercial break. Z-Rod 103.7 FM, JTV channel 55. We'll be right back after these words.
Let's talk about sex.